You took your sleeping pill last night at 10 p.m. like you do every night. You fell asleep within 30 minutes. You slept through until morning without waking up once. Your doctor said this was a good thing. Your doctor said the sleep was helping you. But what if I told you that while you were lying in that bed thinking you were sleeping, your brain was not resting at all? What if the thing you take every night to fix your sleep is actually preventing the one type of sleep your brain desperately needs to survive? And what if that missing sleep stage is the reason you can't remember where you put your keys this morning, why you called your daughter by your sister's name yesterday, and why you feel more exhausted now after 8 hours of medicated sleep than you did years ago on 6 hours of natural sleep? There's something happening inside your brain every single night you take that pill. Something your doctor never explained during that 7-minute appointment when the prescription was written. Something the pharmaceutical studies measured but never highlighted. Something that shows up on brain scans as clearly as a broken bone shows up on an X-ray. And yet almost nobody over 60 taking a sleeping pill has ever been told about it. I'm going to show you exactly what that pill does to your brain from the moment you swallow it until the moment you wake up confused about what day it is. I'm going to show you the one type of sleep that medication completely erases, and why losing that sleep is connected to every single cognitive symptom you've been blaming on aging. And I'm going to give you the exact protocol that restored natural deep sleep to patients who hadn't slept without a pill in over a decade. By the end of this video, you'll know more about what happens in your brain during medicated sleep than most family doctors learn in their entire training. You'll know the 3 blood tests that reveal whether your sleep medication has already caused measurable brain damage. And you'll know the exact alternative that produces real, restorative sleep without any of the cognitive destruction. If you've been on Ambien, Lunesta, temazepam, or any benzodiazepine for longer than 6 months, what I'm about to tell you will completely change the way you think about that little pill on your nightstand. Let me tell you about Margaret, 71 years old, retired accountant from Sacramento, sharp as anyone I'd ever met. She could recall client details from cases she worked on 30 years ago. She never forgot a birthday. She managed her own investments. Then at 68, she started having trouble sleeping. She'd wake up at 2 in the morning and lie there staring at the ceiling until dawn. Her doctor prescribed Ambien, 10 milligrams every night. Within a week, she was sleeping through the night again. The doctor called it a success. Margaret thought her problem was solved. 3 years later, her daughter brought her to my office because Margaret had left the stove on twice in 1 week. She'd driven to the grocery store and couldn't remember why she went. She'd asked her daughter the same question 4 times in one conversation. The daughter was terrified it was Alzheimer's. I ordered a sleep study. What we found was shocking but not surprising. Margaret was sleeping 8 hours a night, but her brain was spending less than 11 minutes in deep sleep. 11 minutes out of 480. A healthy brain at her age should be getting 60 to 90 minutes. The Ambien was knocking her unconscious, but it was completely blocking the brainwave patterns associated with deep, restorative sleep. For 3 years, her brain had been running on fumes. The memory problems weren't Alzheimer's, they were sleep deprivation. Chemically induced sleep deprivation that her doctor had prescribed and called treatment. Before we go any further, I want to know something. Comment below and tell me where you're watching this from. Because what I'm about to explain is happening to seniors in every country where these medications are prescribed. And the number of doctors who understand this mechanism is shockingly small compared to the millions of prescriptions written every single year. Here's what your doctor didn't tell you about how sleeping pills actually work. When you swallow Ambien, Lunesta, or any benzodiazepine like temazepam or lorazepam, the drug travels to your brain and binds to something called GABA receptors. GABA is your brain's primary calming neurotransmitter. When the drug binds to these receptors, it forces your brain into a sedated state. You lose consciousness. You stop moving. You appear to be asleep. But appearing to be asleep and actually sleeping are not the same thing. Natural sleep moves through specific stages in a very precise order: light sleep, deeper sleep, deep slow-wave sleep, and REM sleep. Each stage has a distinct purpose. Each stage produces specific brainwave patterns that can be measured on an EEG, and each stage is absolutely essential for different types of brain maintenance and repair. Sleeping pills specifically and powerfully suppress the 2 stages that matter most for memory, learning, and long-term brain health. Deep slow-wave sleep and REM sleep. During deep slow-wave sleep, your brain clears out toxic waste proteins that build up during the day. One of those proteins is called beta amyloid. Beta amyloid is the same protein that forms the plaques found in the brains of Alzheimer's patients. Every single day, your brain produces this protein as a natural byproduct of thinking, learning, and being awake. Every single night during deep sleep, your brain activates something called the glymphatic system, which is essentially a waste clearance system that flushes beta amyloid out of your brain tissue and into your bloodstream, where it gets filtered out by your liver and kidneys. This only happens during deep, slow-wave sleep. It does not happen during light sleep. It does not happen during sedation. If you do not get deep sleep, the beta amyloid stays in your brain. Night after night, month after month, year after year. It accumulates. And when it accumulates beyond a certain threshold, it starts forming plaques. The plaques damage neurons. The neurons die. Memory fails. Thinking slows. This is not aging. This is what happens when your brain is prevented from cleaning itself. Sleeping pills block deep, slow-wave sleep. Studies using EEG monitoring have shown that people on Ambien spend up to 70% less time in deep sleep compared to natural sleep. They're unconscious for 8 hours, but their brain never enters the state required to clear the toxic waste. Dr. Andre conducted a study on patients over 65 who had been on sleep medications for more than 2 years. He measured their beta amyloid levels using a specialized PET scan. Every single patient in the study had elevated beta amyloid in their brains. Not some of them, all of them. The patients who had been on the medication the longest had the highest levels, and the areas of the brain with the most beta amyloid accumulation were the same areas responsible for memory formation and recall. These patients weren't developing Alzheimer's because they were old. They were developing the biological markers of Alzheimer's because the medication they took every night to help them sleep was preventing their brain from cleaning itself. Now let's talk about REM sleep. REM stands for rapid eye movement. During REM sleep, your brain processes emotions, consolidates memories, and integrates everything you learned during the day into long-term storage. This is the sleep stage where your brain makes sense of your life, where it files away what matters and discards what doesn't, where it connects new information to old information and builds the networks that allow you to recall a name, recognize a face, or remember what you did yesterday. Sleeping pills suppress REM sleep even more aggressively than they suppress deep sleep. Research published in the journal Sleep Medicine found that adults taking Ambien experienced a 50 to 60% reduction in total REM sleep time. 50 to 60%. Imagine trying to run your household if someone took away half your storage space. That's what's happening to your memory every night you take that pill. Without adequate REM sleep, new memories don't get stored. You meet someone new, and you can't recall their name 5 minutes later. You have a conversation, and you can't remember what was said. You put something down, and you have no idea where it went. Your family starts worrying. Your doctor starts testing for dementia. And the entire time, the cause is sitting on your nightstand in an orange prescription bottle. Here's what makes this even worse. The longer you take sleeping pills, the worse your natural sleep becomes. Your brain adapts to the presence of the drug. The GABA receptors become less sensitive. You need more of the drug to achieve the same effect. But even when you increase the dose, you're still not getting real sleep. You're just getting deeper sedation with even less deep sleep and even less REM sleep. And when you try to stop the medication, your brain goes into withdrawal. The rebound insomnia is so severe that most people cannot tolerate it. They go back on the pill within 3 or 4 nights. And the cycle continues, year after year. The brain gets worse, the memory gets worse, the dependence gets worse, and the sleep never actually improves. Margaret had been trapped in this cycle for 3 years. When I explained what was happening, she started crying. She said nobody had ever told her any of this. Her doctor had given her the prescription in less than 5 minutes, told her to take 1 pill every night, refilled it automatically every month, never asked how she felt, never checked her memory, never mentioned brain waste clearance or REM suppression or beta amyloid accumulation. Just refilled the prescription and moved on to the next patient. I told Margaret we were going to fix this. but we had to do it carefully. You cannot stop these medications abruptly. The withdrawal can be dangerous. It can cause seizures, severe anxiety, and rebound insomnia so extreme that people sometimes end up in the emergency room. The taper has to be slow, gradual, and supervised. At the same time, we had to address the root cause of why she wasn't sleeping in the first place. Because if we just took away the pill without fixing the underlying issue, she'd be right back where she started, awake at 2 in the morning with no solution. Here's what most doctors miss. Insomnia in adults over 60 is almost never just insomnia. It's a symptom of something else that nobody bothered to investigate. In Margaret's case, we ran a full hormone panel. Her cortisol, the stress hormone, was sky high at night when it should have been low. Cortisol is supposed to drop in the evening to allow melatonin to rise and signal your brain that it's time to sleep. Margaret's cortisol was staying elevated all night. Why? Because 3 years earlier, right around the time her sleep problems started, her husband had been diagnosed with early Parkinson's disease. She was his primary caregiver. She was under constant stress. Her body was stuck in fight-or-flight mode 24 hours a day. The elevated cortisol was blocking her melatonin. The lack of melatonin was preventing sleep. And instead of addressing the stress, her doctor had just given her a pill to knock her out. We also checked her magnesium. Magnesium is essential for calming the nervous system and promoting natural sleep. Her level was 1.4. Normal range starts at 1.7. Low magnesium is incredibly common in seniors, and it's one of the most overlooked causes of insomnia. We checked her vitamin D. It was 18. Optimal is between 50 and 80. Low vitamin D disrupts sleep architecture and is strongly associated with poor sleep quality. And we checked her thyroid. Her TSH was 4.2. Technically within normal range, but on the high end. Subclinical hypothyroidism, where the thyroid is sluggish but not quite failing, is another common hidden cause of sleep disturbance in older adults. We had 4 fixable problems: chronic stress, low magnesium, low vitamin D, and subclinical hypothyroidism. Not one of them required a sleeping pill. Every single one of them had been missed because nobody had looked past the symptom. Here's the protocol we used. First, we started a very slow taper of the Ambien. We reduced the dose by 25% every 2 weeks. That's slower than most doctors taper, but it's the only way to avoid severe withdrawal. At the same time, we added magnesium glycinate, 400 milligrams every evening 1 hour before bed. Magnesium glycinate is the form that's best absorbed and most calming to the nervous system. We added vitamin D3, 5,000 IU every morning with breakfast. Vitamin D is fat-soluble, so taking it with food improves absorption. We addressed her thyroid with a low dose of natural thyroid hormone. Not because her labs were severely abnormal, but because optimizing thyroid function in someone with sleep disturbance often makes a dramatic difference. And we worked on her cortisol. I referred her to a therapist who specialized in caregiver stress. We also added an adaptogenic herb called ashwagandha, 300 milligrams twice daily. Ashwagandha has been shown in multiple studies to lower cortisol and improve sleep quality without sedation. Within 2 weeks, Margaret noticed she was falling asleep faster, even though we'd reduced her Ambien dose. Within 4 weeks, she was sleeping through most of the night on half the dose she'd been taking. By week 8, she was off the Ambien completely, and for the first time in 3 years, she was sleeping naturally. 7 hours a night, waking up once to use the bathroom and falling right back asleep. No grogginess, no confusion, no fog. We repeated the sleep study 3 months later. Her deep sleep had increased from 11 minutes to 73 minutes. Her REM sleep had gone from fragmented and suppressed to full, continuous cycles. Her brain was finally getting the sleep it needed to clean itself and store memories properly. 6 months later, her daughter called me. She said her mom was back. The sharpness, the memory, the ability to follow a conversation without asking the same question twice. All of it had returned. Margaret told me she felt like she'd woken up from a 3-year fog. She said she hadn't realized how much the medication had stolen from her until it was gone. Now let me give you the 3 blood tests you need if you've been on a sleeping pill for more than 6 months. First, Ask for a high-sensitivity C-reactive protein test, also called HSCRP. This measures inflammation in your body. Chronic poor sleep and beta-amyloid accumulation both cause inflammation in the brain. Elevated HSCRP is an early warning sign that your brain is under stress. Second, ask for a homocysteine level. Homocysteine is an amino acid that builds up when your body isn't processing B vitamins correctly. Elevated homocysteine is toxic to brain cells and is strongly associated with cognitive decline and Alzheimer's risk. Poor sleep raises homocysteine. Third, ask for a fasting insulin level. Insulin resistance, where your cells stop responding properly to insulin, is directly linked to poor sleep quality and Alzheimer's development. If your fasting insulin is above 5, your brain is already struggling with glucose metabolism, and sleep medication is making it worse. If any of these 3 tests come back abnormal, you now have objective evidence that your sleep medication is affecting more than just your sleep. It's affecting your brain's long-term health, and that gives you the data you need to have a real conversation with your doctor about tapering off and finding an alternative. Here's what you say at your next appointment. Doctor, I've been on this sleeping medication for over a year now, and I've been reading that it suppresses deep sleep and REM sleep. I'd like to run 3 tests to check if it's affecting my brain health: high-sensitivity CRP, homocysteine, and fasting insulin. If those come back elevated, I'd like to work with you on a supervised taper and address the root cause of my insomnia instead of just sedating the symptom. Bring this video if you need to. Bring printed studies if that helps. But do not let your doctor dismiss this as unnecessary worry. Your brain's ability to clean itself and store memories depends on real sleep, not sedation. Now let me tell you the exact alternative protocol that works. Magnesium glycinate, 400 milligrams 1 hour before bed. This calms your nervous system naturally without suppressing sleep stages. Vitamin D3, optimized to a blood level between 50 and 80. This regulates your sleep-wake cycle and supports deep sleep architecture. Ashwagandha or L-theanine for elevated nighttime cortisol. Both have strong evidence for reducing stress and improving sleep quality. And melatonin, but not the way most people use it. Most people take 3 to 10 milligrams of melatonin and wonder why it stops working after a week. The effective dose for sleep regulation is much lower, 0.3 to 1 milligram, taken 2 hours before bed. That's it. Higher doses desensitize your melatonin receptors. Lower doses work with your body's natural rhythm. This protocol doesn't knock you unconscious. It supports your brain's natural ability to fall asleep and stay asleep, and it does so without blocking the stages of sleep your brain desperately needs. Margaret is 74 now. She hasn't taken a sleeping pill in over 2 years. She sleeps 7 hours a night naturally. Her memory is sharp. Her brain scans show no new beta-amyloid accumulation. And she tells everyone she meets that the worst medical decision she ever made was taking that first Ambien. And the best decision was stopping it. Your brain is not broken. Your sleep is not unfixable. You've just been treating a symptom with a drug that makes the root cause worse. Now you know what that drug is actually doing. Now you know what tests to ask for. Now you know what actually works. The question is whether you'll take that information and act on it, or whether that pill will still be sitting on your nightstand a year from now while your memory quietly disappears.